Assalamu alaikum, hello and welcome to the special episode of Health Talk. In this show, we are going to discuss pain management and the whole industry of pain management, the latest developments. And I would like to congratulate Society for Interventional Pain Medicine for holding up a wonderful show, the World Pain and Region Conference. Today we have with us Dr. Shahzad Anwar, the president of SIPM. He'll co-host the show and introduce you to our guests. We have with us Dr. Syed Mahmood Ali. He is a famous pain physician and he is the Secretary General of SIPM. We have with us Dr. Andrea Trescot from USA, one of the pioneers of this industry and very famous personality. We have with us Ms. Rubina Ahmed from UK. He is also a very famous pain physician. And we have Ms. Helen Gharaei from Iran. She is also a very famous pain physician. Dr. Sahab, I would like you to start the conversation and discuss the issues of pain management in this country.
Thank you so much. Regarding WPRC, we are really thankful to your contribution as event management, and we are thankful to Allah Almighty for all the success and all the distinguished guests who traveled thousands of miles, came from USA, Andrea, Dr. Rubina, he came from UK, and Helen from Iran. It was not possible without the guidance and mentorship of our seniors and our teachers, and I'm really thankful to all of this. I would ask Mahmood, how does he feel after this such a huge, phenomenal couple of days?
Thank you so much, Dr. Shahzad. It's a very difficult task, believe me, and it's just a sleepless night from the last 2 months. Just as 2 months, I'm saying we planned with our president and chairman, Dr. Jameel Sabit. From the last 6 months, we planned, and thank you to all our international faculty. They reached their contribution to success over to make successful our conference. I'm thankful to all of you. It was a difficult, and we have seen some very difficult challenges because it was going to be our first international conference where all the international delegates come and they join us, so that we can share our experience with them and learn from these our international delegates, so that we can serve better for our patient and for the institute and for our country as well.
Thank you, Dr. Mahmood. I would request Andrea that how is her experience of Lahore in general, and then her very critic comments how we organize WPRC and any advice for the future events.
Well, I've had a wonderful time here in Lahore. It was my first trip to Pakistan, and it will not be my last. It's been delightful. The Pakistani people have been so friendly and so helpful. And it's also been very rewarding to me to see you, who are my students, to have been doing so well and have done so much in your own country. And then to put on a meeting of this size and scope was just very gratifying to see. It was quite an event, has been quite an event. And the enthusiasm for pain management, the recognition of the problems, but instead of just saying, oh, well, there are problems and we can't, you have had a very can-do attitude, which has been very exciting to see. So I think pain management has a great future here in Pakistan, and I'm quite pleased to have been able to give you just that little bit of a push up so that you could do so well on your own.
That was not a little push, that was a huge boost for us.
Big support.
Big support.
Well, it's been my pleasure.
Me, whosoever, me and Rubina told that Andrea is coming, they had no other question. They said, if Andrea is here, we will be there. And
well, thank you.
And if you have been keynote speaker, session chair in all over the world in different, how would you rate today's workshop with any other workshop?
It was quite fascinating. The number of students was far and away better than I've seen in most programs. The quality of the cadavers. I know your listeners may not understand that, but it's really important to have good bodies to work on. And so these were very, very well situated. And so that made my job much easier in teaching. And so, but the students were just couldn't be dragged away. We had to be it would be time for tea, and we want to see more. We want to see more. And so that's also, as a teacher, it's always wonderful to see such enthusiasm, and makes my heart warm.
Thank you so much. And thank you, Dr. Rubina. You have been such a guidance, such a mentor, such a support, and you told me how to write, how to draft the letter. So many small details. I don't have the words to thank you.
Thank you.
You were here a couple of these days before. We had some dry run as you do these things. Thank you so very much.
You're welcome, and always.
And how would you rate this conference? You have been all over the world. You are on the faculty of WIP, Pain School International. I mean, all world-class pain management associations. You have been everywhere. So how would you rate this event, conference, the gala dinner, and today's workshop, technical program?
I have to first say thank you very much for inviting me, making me part of the family. And I was a little apprehensive because we had communication gaps in between. But the execution was beyond my expectations. It was so beautifully executed. More importantly, what surprised me was that, yes, like Andrea said, there was lots of enthusiasm by the candidates. But it really surprised me when I asked a few people. They were from different specialties as well, different backgrounds as well. From orthopedics, from neurosurgery, from medicine, which is
from radiology.
From radiology.
Even some general surgeons were here.
Yes, exactly. Which I think is, which speaks very highly about this conference, because if whatever groundwork or homework you have done during this time, it clearly speaks about itself. We don't have to put any words into it. The other thing that I noticed was that, like Andrea said, that they wanted to learn everything on the workshop. Everything, So there were certain specific workshop plans to do, but they had read also, so they wanted to know this, they wanted to know that. They were happy to swap bodies, turn around everything, that if you can do this as well, and just show us, and then next time we will think about it. So, and some of the surgeons were very well read. They had actually studied before coming. I came across a couple of other speciality doctors who also had MRI scans on their phones, and they wanted to know for a patient that what's the best technique and best way of knowing it. So I think it was beyond my expectations. I'm sorry, but it was,
It's
the entertainment, I think you just cracked everything on this one. The entertainment was so nice. We don't get, yes, we go around, but we don't get all this pampering elsewhere. So thank you very much for that. Thank you for gifting us with nice shawls and nice, it's so humbling. So I feel that I do come to Pakistan, I do come to Lahore, I've got friends and family, but it's like a flying trip in and out. This was so professionally done. I'm really, really grateful, and thank you for making me part of you.
And I feel sorry if you are apprehensive in between, because I'm a practicing physician.
Yes.
I run 2 practices. I go to a medical college. So even trust me, getting to my iPhone and opening email is not possible even for a week sometimes. So preoccupied. I apologize if that caused an inconvenience.
No, not at all, not at all. I didn't know, actually, that you were such a big boss.
No.
If I would have known, then
I'm just a humble student of all of you and junior to you.
So thank you very much for making me part of your family.
Thank you. Dr. Helen, our friend, our teacher from Iran, thank you so much for coming. We know it was very difficult to go along with Pakistan embassy people. First time she was refused visa. Then we arranged a letter from the foreign ministry. Then she was lucky. We were lucky actually that her visa was processed. Then her flight was returned because of the bad weather, and she was awake all the night. And even then she came, and one of the very good lectures we had from her. And we had wonderful session with her in the basic, everything. And you have been to different parts. You have been to India, other countries. And how will you compare and rate our activity, our program, technical session of symposium and this workshop, basic and both advanced thing? How will you rate this, ma'am?
First, I want to thank you, Dr. Shahzad, for inviting me to this beautiful country. And I want to say that I feel I'm in my home, because Pakistan is one of the best neighbors of Iran. And pain management is really a new course around the world, although it passed about decades from the beginning of pain management. And I'm very happy that Pakistan started to grow this course. I know that pain management still is active in Pakistan from many years ago, but for growth of any specialty in a country, we need a great manager like Dr. Shahzad Anwar, Dr. Syed Mahmood. And I think with this man, we expect a very, very, very good growth of the pain management in Pakistan. And I see many enthusiasms comes from USA to Pakistan to learn intervention. And I saw many good conference from Pakistani expert, from foreign expert, very renowned expert from USA, from UK, and many enthusiasm participate in this conference, many young enthusiasm, and I love them, and I wish I could teach them in this workshop and workshop of tomorrow. And it was a great conference, Dr. Anwar. Very, very great. One of the world-class conference that I participate in my life. Thank you very much.
Thank you so very much. Thank you.
Andrea, I would like to ask you, how do you see the pain management industry and the pain medicine industry in Pakistan, and how do you compare it with the one in USA or in any other part of the world? What are the challenges, and how do you see the developments?
Well, you certainly have a lot of challenges. You have a tremendous limitation of opioids, so your cancer pain patients, your palliative care patients are, it's a huge challenge to treat them. You've had limitations in equipment, limitations in the facilities, but I think step by step, we're doing this one student and then 2 students and then 5 students and then 15 students, and each of you has gone out and taught more. So it's been a multiplying effect. So this is a contagion. We've inoculated the pain virus into you, and I hope there's no cure for it. Yes. I hope it spreads through the whole country.
It is getting viral already.
I think it's getting viral already. So it's a slow start. It's very hard to take something from nearly nothing to something, but like pushing a car that has a dead battery, you push and push and it starts to roll, and then it starts to move, and then you can let the clutch out, and then the engine catches, and soon it'll be able to run on its own. So I see great promise for Pakistan. There are many challenges. I won't doubt you that. It will be a difficult path, but you have gotten the attention, it seems, of people in high places. And so I think you'll see very soon that you'll get much more in the way of support. And I think programs like this that bring this concept to the people, they will start to demand this as an option. When you didn't know it existed, you didn't know what you were missing. But I think it will be more and more clear to the Pakistani people that this is something that they deserve. This is something that Pakistanis can do for Pakistanis, and that will also help move the field along.
Right. So, Dr. Rubina, can you briefly chalk down the challenges as Andrea mentioned, and she's been teaching like all of us and all of you. So, what are the challenges being a Pakistani origin person? You can probably better identify those in Pakistan. What are the challenges?
Challenges are everywhere. It's not only in Pakistan. So I think if I compare it to UK where I work, I feel that you have more liberty and more flexibility here. So you will be able to overcome your challenges quickly. In the West, all our challenges are attached to protocols, to guidelines. So there's very little maneuverability for us. Also, the economic challenges now in the West do not allow us to fly as high as we would like to. So we have reservations there. And at this end, I feel that it is a two-way learning curve. So we will come here to learn how to do it the economic way. And that will help us at the other end. Challenges are all over the world.
All over the world.
At the same time, there's a huge population developing and growing all over the world. There's more awareness. Pain has now been accepted as the 5th vital sign in the world, and it has been also recognized as independent specialty. So I believe that it's a two-way pathway. We would learn lots from your end, and we will come and deliver as much as we can. Right. So challenges, we have to face them.
Challenges are everywhere.
Yeah.
Dr. Helen, would you like to tell us about how is the pain physicians practicing in Iran? How is the industry there? What challenges people face? And do you see any new developments comparing to Pakistan or other countries of the region?
Okay. I'm very happy that you start multidisciplinary pain management. I'm very happy that see many specialty and subspecialty in this conference, and this is a very good point because we start with just one specialty, anesthesiology in Iran, and it's caused that the other specialty didn't accept us very good. But when you start multidisciplinary, many specialty come here and want to learn. So the challenge of you between other specialty is lesser compared to Iran. But the most important point is that you must aware people about the value of pain management. When the people understand what is the pain management, they accept is very good. And you must consider what is the most important in your country. In your country and in my country, because we could not use very expensive instrument. We have to learn basic of intervention. We have to learn algorithm of interventional pain management from more not expensive intervention, from more effective intervention, and then step by step. So we can even teach, use ultrasound. As I told you, ultrasound is a portable device and not expensive. We can put ultrasound in every city and teach the physician to use basic intervention. Very simple intervention and very important intervention, because you know, for example, low back pain is a very problematic in every country, our country, because we have many workers. Okay, so we have degenerative joint disease. So if we have, for example, an ultrasound in a small city, we can help people with prolotherapy. Prolotherapy is very cheap. Okay, I don't say you that buy very expensive instrument, because I understand this. I live in Iran. Okay, if you can progress prolotherapy and simple intervention, epidural block, medial branch block in every city, so you can help people too much, and they attract to the pain management.
Right. Thank you. So we are running short of time. I would like Dr. Shahzad and Dr. Mahmood to tell us the future plans of SIPM after putting up a great show in form of WPRC. Sir, how do you see the future? Where do you want to take it further, and what will be the next step?
The aim behind the formation of the Society for Intervention Pain Management was that, first of all, to accept that pain is a vital sign. Number two, it's a disease. Chronic pain is a disease. You have to take it as a disease and treat it. Unfortunately, in our country, it's not accepted, and patients are suffering, and they are either misdiagnosed or the treatment is not according to protocol. And number 3, the person who knows the things, who make a diagnosis, but they unable to perform the procedures or can do the according to SOPs. So we realize these things because of international exposures and our teachers and mentors, that these things to be sorted out. So to make a society and try to teach to pass on our knowledge to our juniors so they can do it. Especially I would like to say, like a cancer patient. Lot of the patients are suffering, but nothing is there because of opioids. Morphine is not available, but alternative approaches are there, but people don't know how to use these approaches.
Right.
So this is a platform where we provide us under the supervision of our teachers and like Dr. Shahzad and Dr. Jameel Sabit. Okay, right. So we can teach them all.
Right. So I'm sure society is doing great. Doctor, what will be the next step after this? How do you see the future developments, and what will be your next step?
Yes, we are working at 2 levels. One is the academic improvements, the other is the skill-based program. So already we have one master's program being offered by Rifa International University, MSc in pain medicine, but that is purely academic, nothing hands-on skills. So what we already have started last year is fellowship in interventional pain medicine. It is not accredited or approved by College of Physicians and Surgeons, but there are many fellowships in the developed world, even in USA, which are not being centrally accredited. So different societies, different organizations, they are offering it. So we are, and the second thing is, one good news is that we already have principally agreed with Pain School International, which has 4 core faculty members. Andrea Trescot is one of them, Agnes Stojica is there, Edith Rex is there, and Fabricio, whose initial idea was this, from Brazil, from Singular. All of these, that we will, in accordance with PSI curriculum, standards and our HEC accreditation, will get this fellowship approved by a public sector university, UHS most likely, and private sector university, University of Lahore or any other university. Will get it accredited during this year, and then the agreement we are trying to have with PSI is that one of the core faculty members, they will come over and will train our faculty along with our own faculty in accordance with all those standards and guidelines which are being followed in the developed world. And then for the exit exam, will follow all the curriculum and criteria approved by HEC, and also for the European accreditation and US accreditation. So this is for the academic, and simultaneously for general people, people who are suffering from cancer pain, from chronic pain, all sort of musculoskeletal or neuropathic pain, we will be regularly conducting free camps. We'll be regularly conducting these camps in different areas in collaboration with our students who are students of fellowship in all parts of the Pakistan, so we can go there. So this will not only improve our students' skills, this will also create awareness among people who are suffering from chronic pain, that they have the right for specialized pain management care, especially chronic pain. So these are the things, and we hope with the support of our seniors, Andrea, Rubina, Aggie, Fabricio, Rex, Miles, Russ, there are so many people. And believe me, my experience at PSI, it's not that Andrea is here, I talk everywhere. Mahmood will tell
definitely,
you.
I know.
That it transformed my horizon. I've been doing pain all my life. I went to China to learn acupuncture. Since I came back in 2000, I've been doing pain, nothing else. But these intervention, and especially regenerative medicine, that's PRP, that is poor man's, as Helen said, and always, Andrea always says during her lectures that even she says, I offer free prolotherapy who quit smoking. Right? So we have learned so much from the PSI, from teachers, and so many things. And we are trying our level best that we can, not only this, that we are also trying to, what I can say, that we can unite all our seniors, all those big names who have been working in pain medicine for years. So we can help our people, both in quality health services and also train our young people so all the population can be served in a better way.
Right, sir. So while we are heading to the end of our show, I would like to ask Andrea Trescot and Dr. Helen, who came to Pakistan for the first time, how do you find Pakistan? How was the food? How was the music? I'm sure you had a lot of fun. So briefly tell us about your experience.
Well, it was first and foremost the people. I think that's the thing that the rest of it is superfluous. If you don't have friendly people, then the rest of your stay is not at all exciting. But this was just, as I said before, the Pakistani people have been just so lovely. And it has been good food, great fellowship, music, and beautiful clothes, and just a taste of a culture that I had never been exposed to. So right. I'm very grateful for the invitation.
Right. So I'm sure next time you'll come for like more days. So Dr. Helen, how was your experience coming to Pakistan for the first time?
I couldn't believe it. I feel I'm in my home. Yes, I couldn't see any difference with my country, especially Sistan Balochistan, because we are in border of Pakistan. I love Pakistani people. They are very friendly, and I love your country because it is colorful. I think this is because of your beautiful nature, beautiful garden. And I love Pakistan too much, and I wish I came here again. Thank you. Please invite me.
We will definitely be inviting you on regular basis.
Yeah. Thank you. We would like you to come again. Dr. Rubina, lastly, you've been the mentor behind all this show. So I'm sure you'll continue to do this. And you like to give any advice to Dr. Saab and the society?
Thank you very much. I feel humbled for being part of this. My advice is to let me know what more I can do for you. And I will take this opportunity and nominate Andrea and Helen for Pakistan to take the word and spread it around their countries.
And bring more people here.
Bring more people here. Give them the confidence that we have a lovely country, best tourism. And it's so nice to be in here and just completely ignore what people say or spread the negativity. Once you experience it, you want to come here again and again.
Right.
I also have the experience of bringing my team when we had the unfortunate earthquake. Everybody remembers it till today. We get together, we keep looking at those photographs, and they do want to come back again. And they came back 3 times after that to help people around. So you need to experience, to have the taste of an experience to come to Pakistan, and then you see that how different it is to what is unfortunately spread around. So I nominate both of them. You take your ambassadorship to Iran, honorary ambassadorship, and Andrea takes the ambassadorship to America, States, and hopefully we'll get more people attracted to come to Pakistan.
Inshallah.
So thanks a lot. Thank you very much.
When we were young students, there was an ad, come for the style, you will stay for the taste.
Right. So as you said, seeing is believing, and people once they come, so then they start believing.
Correct.
Right.
I completely agree. Yeah.
So thank you everyone, thank you all, and we hope that we'll be hosting you and with even better programs than WPRC and for longer days, and we'll have some we will travel to other parts of Pakistan, northern areas. We have the best ski and mountain resorts. I mean, you say it will be arguable as you come from Florida, but still we are amongst the best. And so thank you once more. Thank you everybody.
Thank you very much.
Thank you, Dr. Saab. I would like to thank all of our guests in our panel today, and I would like to thank everyone for coming to Pakistan and mentoring and teaching our students, pain practitioners, doctors, consultants. And I'm sure pain medicine and pain management has a great future in Pakistan and in other parts of the world. That's where we come to the end of our show. Thank you for watching. We'll meet in the next episode of Health Talk. Thank you.